Hey everybody, Craig here with another video update. Thank you to everyone for your hard work and working with us to make sure this telecommuting is all working. You guys are doing a great job. Like you, I'm glued to the television, watching the news, watching those reopening announcements, listening to the governor's plan about getting back to business, and we are expecting that to continue to make very slow, steady progress and get people back to work. We kind of are in a holding pattern here at Western. Things are kind of in a smooth state right now. Operations is going great. We're getting work done. We've got a lot of things going on. So I'm not in a real hurry to change things and get people moving around again. But we are continuing to do that planning work. So you'll hear more about that in the future. I am going to reduce the all staff emails that are going out a couple times a week to once a week. And we're also going to kind of cut back these videos to once every 2 weeks. So get ready for that change. All right, quick Western health update as always. Our one employee who tested positive for COVID-19 is doing great and is back at work, so that's good news. No positive tests amongst other Western staff, so that's great news. You're hearing in the news about the county and they've changed some of their limitations, but the state is still sticking with their programs. So we'll keep watching that. They are still adhering to face coverings and social distancing. So we'll be doing the same here in the office. On our city chamber call, we did hear a report of one hospital that's seen a surge in cases this week. So that's kind of interesting. We'll keep watching that, but everything else was kind of standard discussions about getting back to recovery activities. So don't ditch those face coverings quite yet. We still need them and we still need to control coronavirus. When you're working at Western, we've had a lot of discussions with our team here as how we're going to get back to work. But what we're requesting is that when you're in your workspace, your face covering is optional, so you don't have to wear it, but if you want it and you're more comfortable, please wear it. But when you're walking around the office and you're in public spaces where you might bump into people, we want you to be wearing that face covering. So as you're up and around and moving around the office, wear the face coverings. When you're in your cubicle or your workspace, it's totally up to you what you want to do. All right, so let's talk a little bit more about our reopening plans. So Governor Newsom is moving to phase 1, stage 2 of reopening California. And that's been a little confusing on the news, so we're watching that and trying to make sure we understand what that means. As I've said in previous videos, we're not really in a rush to reopen. Our business is getting done thanks to all of your creativity. So don't get anxious about all the talk on the news. We're going to give you plenty of time to prepare if we do bring people back. I can tell you we won't be starting any sooner than June 1st. And I don't know that it'll be by June 1st. We're finalizing our plans and we haven't quite finished that plan, but as we finish it probably this week, your department heads will be sharing that with you so that you can start planning. Keep in mind every department will be a little bit different and has different needs, so plans will look a little different from department to department, just as they did as we kind of transitioned into our telecommuting. We found that every department had different needs, so you'll probably see that as we get back into full operation again. All right, keeping this update short and sweet, I just want to leave you with this. We should all be really proud of what we've accomplished in the last 9 weeks. And as Peter Marshall says, teamwork is what makes the dream work. I couldn't be more proud of the Western team. Keep it up. We're all doing a great job in getting things done. We're going to get through this together. And until next time, be safe and stay healthy.